This is exciting for all of us. Sujith and I started this journey probably about 14 months ago or so of just, man, this would be really interesting to look at this concept of introducing and accelerating the maturation of individuals that have decided to move into the community setting. And there's such a belief on our co-chairs of the viability and the importance of that setting, that understanding how we can play a role into the future and having a legacy value to an initiative that is just not tonight. Believe me, I mean, we have committed a long-term approach to what COFAI is. And what you'll see tonight is a snapshot of it, but it's the start. It's definitely the marathon concept versus the race. So we're going to kick it off right now. Again, thank you for joining us tonight. Brian, I'm going to keep going. Next slide, if you're cool with that. So next slide. So I'm the tee up for this because it's a new concept, quite frankly. I don't think anybody has really looked and directed the amount of activity and effort into this sector like this collective group has. And we believe in it so much. And there's a rhyme and reason, and there's also a mission associated with this. And literally, we have built this thoughtful and disciplined approach. And this is all around the concept of the next leaders, right? The next leaders of community oncology, and how do we assist in that process in the most authentic way? And I think many of you, through interviews that we've done leading into this, there's many gaps that exist from that transition from, let's call it, an academic or institutional setting into what I think you're obviously seeing is the dynamic nature of community oncology. It's not one size fits all. It's not one element. It's the diversity of it. It's the dynamic nature of it. It's the challenges that come a part of it as well. And I think, and I don't want to be too dramatic, but the viability of the future of community oncology is at stake. We are all believers in this site of care. I believe it is one of the most powerful site of cares in treating cancer patients. I think the activity and the ability for these groups that are represented here to perform is exponentially as great, if not better, than any other line or site of care out there. But I think there is a challenge when you look at the numbers, that the future from a supply and demand side does not look promising from the standpoint of the amount of cancer patients that should be treated in the community sector and the amount of clinicians that'll be viable for it. So our ability to be a part of what this can do, not from 2 months, not 2 years, but 20, 40 years, I think is really our bedrock behind what energizes for us. And when we look at this dedicated activity, so this activity is going to follow a disciplined approach, and we'll take you through it. And it's important for us to set the table that way, because this program is for the participants at the end of the day. I mean, we're giving up our time, not giving it up, but we're giving our time, our effort to ensure that this is done the right way, that there's no misaligned incentives, there's no bias, there's nothing that gyrates the program other than the authenticity of creating a lane specifically on clinical immersion in the community oncology, and then also personal financial wellness as well. Next slide. So those are the 2 lanes for COFAI. We split them up. We were originally going to do a long session on a Saturday. I think there's obviously challenges with doing weekend programs. We felt like this was best served to introduce COFAI and do it as a 2-step approach, which tonight, the immersion in the community oncology, and then on Thursday, the financial wellness component. Next slide. And you've seen this through the invitation process. There's a lot of elements. Boy, there's a lot to this. So it's not only these elements, and it's not limited to that, but there are many things that we're going to take you through, both on the indoctrination and community oncology, but also the personal wellness program as well. And our goal tonight is to give an introduction and to get your feedback, either verbally through conversation, so there's no mute button tonight whatsoever, or through surveys or audience response, because that's where the customization begins. Next slide. And I wanted to introduce, before we go any further, the co-chairs have been not only fantastic to work with, capable, credible. I think they believe in this mission, but I've said this before, if you surround yourself with good people, good things will happen. And these are great people. And I just enjoy their company and enjoy the stimulated conversation and just their innate ability to deliver something of value, and the desire to deliver something of value. It just has created this just dynamic amongst the co-chairs that I believe you'll see and it translates into a conversation and an effort and value that hopefully you're able to achieve not only today, but throughout the life of COFAI. So I'll turn it over to the co-chairs just to introduce yourself. And if you want to just give a top line of what was your experience going into the community? And then number two is, why are you a part of this? Why do you want to be a part of this? So Sujith, you and I have been on the forefront of this for, like I said, about 14 months. And I know that this has been, a mission for you from your days at the Cleveland Clinic. So why don't you kick us off?
All right, there we go. So Sujith Kamadi from Ironwood Cancer Center. I'm a general medical oncologist and also the chief medical officer of a group. We have about 42 medical oncologists, about 11 radiation oncologists, about 12 urologic oncologists, about 9 breast surgeons, and a couple of gynecologic oncologists. So I help to manage the practice and also have a fairly busy practice. Although some claims I do not work enough, so I'll have to figure that out. So prior to coming here, I did my residency and fellowship at the Cleveland Clinic in Ohio. Then I decided to stay on as faculty in GI and thoracic oncology. Did that for a couple of years. Then my career led me over to Houston, where I was faculty at Baylor, also with Texas Oncology and Baylor, combined practice for about a year, and then finally landed up in Phoenix, Arizona. We started off a group when I joined, that was about 14 years ago, of about 8 medical oncologists. So we've grown over the last 14 years through internal growth as well as mergers with our other practice to this large organization. We have about 1,000 employees and such, about 75 oncology-related physicians. So over the process, I've grown and learned things in medical oncology, things in the administration. It's been very fruitful, not knowing anything, to the point where I'm today. I transitioned from an academic lifestyle, being in an academic practice for about 3 years prior to joining community practice, and I had to learn things as I went along.
Thanks, Sujith. Josh?
Good evening. Joshua Cox. I'm the Director of Pharmacy and Research at Dayton Physicians Network in Dayton, Ohio. We are a fairly large practice. We have about 38 physicians in the medical oncology, radiation oncology, and urology spaces, about 450 employees, 6 locations, an accredited specialty pharmacy at our central location. And Joel, I think, you kind of led into, what I kind of think my goal or a goal for the program really is, and is that I don't think it's exaggerating to say that the future of community oncology is at stake, right? I mean, we need strong leaders who understand the business of oncology. I've been with Dayton Physicians for almost 13 years now, came from a hospital setting prior to that, and I knew exactly nothing about the business of oncology when I started. So the learning curve was steep, and it's been an enormous benefit to have that understanding. And I wish that I had the opportunity to have some mentors, and I have had some mentors, but maybe a more formal mentorship in the beginning, because ultimately I hope that this program will equip the participants to be the leaders in community oncology moving forward. So with the ultimate goal of making sure that this model is viable, so that patients across the country can have access to what you referred to as one of the strongest sites of care, right? But it's the that site of care that provides the highest quality and the highest value and the easiest access. So I think it's important that we're doing this program in order to ensure that our future is strong.
That's great, Josh. Thank you. Annette?
Yeah, I'm Annette Fontaine, and I am from Albuquerque, New Mexico, part of New Mexico Cancer Center. And like my colleagues, our practice have branched out from medical and radiation oncology into a multi-specialty group. We have urologists, pulmonary, primary care, ENT, and growing. And of course, the reason for that is for survival, of community oncology. And I was fortunate, I trained in Morgantown, West Virginia, where community oncologists were actually associate professors at the university. So, as a senior resident and fellow, we would get to assist them when they were going on meetings, round on their patients. So, I was introduced to community oncology early and joined my group right out of fellowship. But like Josh was saying, you join a community oncology group and you know nothing about business, and I always wanted to learn the business of medicine. So I did an MBA, but it's an MBA. It doesn't really prepare you for what's happening right in your practice. It's really getting involved in the administration of the practice and understanding the day-to-day runnings that really helps you. So, when I was invited to participate in this, I was excited because I felt that there was a deficiency when I joined the group, and I really had to push myself forward, and invite myself into the administrative team and let them, I'm interested in this, I want to know about this, I want to learn. And I'm hoping that we can excite all of you to take that initiative in your groups and become the next leaders.
And that's great. Thank you for being a part of this. Bimal?
Hi, my name is Bimal Patel. I'm a medical oncologist. Also, just like everybody on the panel, Sujit, Annette, part of a large group that's historically has roots in medical oncology, but has evolved as the landscape in the sense of consolidation has evolved. So from being a pure medical oncology practice over the years, we became a medical oncology, radiation oncology, and then with surgical oncological arms like breast surgery, etc. So we are in San Francisco East Bay. We've been around for 40 plus years. I've been in the practice or with the practice for 30 years. There are about 54 physicians, about 10 advanced practitioners, and about 400 employees. So 350, 375, something like that. So it'll be great for me to bring to COFAI life experiences of somebody who, just like all of you, after training, we start our professional journey, and Sujit kind of gave a bit of what his journey was like, and some of us, like Annette and I, both went straight from fellowships into a private practice or a clinical setting, and then things evolve and we learn, and it'll be great to impart, so to speak, such insights and experience for the benefit of others in forums like this that COFAI is sponsoring. So good to be here.
Thank you, Bimal. Can we go to the next slide? And these four are leaders in the community. So, they get 50 requests a day. So for them to be a part of this, I'm just overjoyed with it. But also they bring just differential backgrounds that I think is going to round out this program. And it's just a view into it, because we're talking about the diversity of community oncology. It's not one lane. I mean, there's so many elements and sub-elements to it. And to have this level of expertise, I think is just, it's going to make the program, quite frankly. And I think it's going to provide that long-term value that we've all talked about. That other lane we talked about, which is the personal financial wellness, we have agreements with national organizations like Morgan Stanley, Cohen and Company, and McCarthy Levitt, that they are there to be content experts. There's no other purpose with that, and you'll see that on Thursday night. But I want to thank the co-chairs again. I think that's a very well-rounded group, and our conversation to this point, as far as rounding out this program, has been extremely provocative. It's been very complimentary, and it's been for the sole purpose of creating that bridge across the gaps that we identified. So next slide. So then the other element is who's Cornerstone. So some of you might know us, some of you don't. Just to give a quick snippet on us, which is we focus in on the community. I've 27 years in especially therapeutics, most of it in oncology, and almost all of it in oncology, into the independent community oncology practices. And our goal is to maximize the quality care, patient care. And we do it through network aggregation. So if we're not finding value-added opportunities to create a sustainability in the community, we're not doing our job. And it is that partnership that is critical to what we do. Next slide. And it's why it's Cornerstone, right, to run this program. We hear all community oncology all the time. So our view is, as I alluded to, this site of care is so critical to optimizing patient care for these cancer patients, that the independent model, to me, from my view, is such a critical element to it. And it's under fire right now. There are challenges. So if we can play a role in that paradigm, we're doing our job. So if you look at this as an element to sustain community oncology for the future, it fits well with us. The second area is, we are managed by business-minded folks. So we have full-time employees that really look at how we can create value in the marketplace. So looking at these areas, more so probably on the business side than the clinical immersion. These are the experts, being the 4 co-chairs. But our sole focus is to create these value-based opportunities. So we'll learn things through COFAI, but we'll put them to work for you as community oncologists to create a level of sustainability amongst your practice that has that legacy value, hopefully for you as you become a leader within your practice, and you can take it to the next, handoff that's, generational within your practice. So, and it's led us down the right path. We're not a Trojan horse model. There are very limited things that we do that is based off of, an expectation from our practices and our clinicians. It is based off of creating value and having a level of participation. It's culminated in this network is the largest independent community oncology network in the US. And that's since the inception about 5 years ago. Next slide. So when we start looking at what's the approach and what's the right approach, as we alluded to, we're business minded, but also we're very disciplined and classical the way that we put a curriculum structure together. And we look at this as an adult learning approach. And the 2 pillars of an adult learning is the intrinsic motivation and the problem center, right? So the intrinsic motivation is, I want to get better. I want to create value for my practice. I want to understand all these elements. I want to become a leader. And then on the other side is I want to do things right for my family from a personal wellness perspective. I want the ability to make sure that all the hard work I put in creates an opportunity or multiple opportunities for my family. And then it's problem solvers. Okay, what are those gaps? What are those areas that we can really dig into? So that's the bedrock of adult learning. So if you look to the right, what we're leveraging is what they call a channel filter approach, which is those 2 worlds being immersion in the clinical community oncology and personal financial wellness. Those are so broad. So if we wanted to take a deep dive into all those elements, we're here for a week, and Bimmel's not spending his entire vacation on this Zoom. So we had to look at this as a channel filter, which is a general introduction. So what are all those relevant areas for tonight being immersion in the community oncology, and then for Thursday, the personal financial wellness, and introduce those, right? So it's a preview, it's an introduction. So you're not going to get the punchline. You're not going to get the secret sauce. It is literally an understanding of, here are the elements that are very pivotal to increasing the overall productivity of a clinician as well as an oncology practice for tonight. And we're going to ask you questions. So we're going to do it, audible related. So questions out to the group, ARS, audience response, and a survey. And you're going to tell us, what are your gaps? And gaps are okay. It's a self-awareness exercise, which is, where do you want to improve? And then also, what are the relevant areas of focus? So we take that information, and then the next phase is to drill down on those areas. So channel filter it into the areas that are most relevant. They're going to provide you the greatest amount of value. And then we bring in the content experts. Then we have the individuals that are the co-chairs here to go deep on things such as OIG affairs and the finances of a practice, to clinical trials and things like that, that it will be an extensive tutorial. So case studies, individual engagement, and application. So I bring that up, and I'm very intentional on that, is that this is a marathon approach that we're taking here, but it's very methodical and it's very disciplined in adapting this adult learning approach to the curriculum structure that we've put forward. Next slide. So this just depicts it even more. So if you look at it, it's a partnership and customization. The more you tell us, the more you guide us, the better we're going to do. So tonight is the buckets and elements. So the 4 main elements you're going to see tonight is a SIT analysis of healthcare from a macro micro, community oncology landscape, the infusion, dispensing pharmacy strategy, and then the strategy of community oncology. That's the start. So that's the right. That's the marathon start. Then it's customization. We start lifting up. So it's a needs assessment, market research, personal content build out. And then we go into a content deep dive where we're hitting the mark on the areas that are going to serve you the best and allow you to create the greatest amount of value for you personally as well as you professionally. Next slide. and not to be trite, we can call it COFAI University or whatever. We're allowed to have a little bit of fun with this, but we definitely want this to be a partnership over the long term. So stick with us. I mean, the incentive, as I alluded to, there's no Trojan horse to this. Your growth and maturation is our incentive. It's a bridge to where this specialty and where this site of care can go into the future. So we are in this to customize it, to be as intentional as possible, but that's going to start through an interactive exchange between us and you. What we're trying to do tonight is create a stimulus to create that exchange. Next slide. So the agenda, and this should put a smile on Sujit's face, because I am right on target, my man. I'm right on. So I can't be blamed if this encroaches the outer realm of the time frame associated with this. So, and Sujit will laugh because he tends to tell me that it takes me an hour to make minute rice. But besides that, we got through the first section here, and then I think if you look at the bottom part, what's critically important is this is the first time it's being done. So we're in uncharted territory here, but we have spent a tremendous amount of time and we've put a lot of effort into a disciplined approach that we think is the best step forward. But you're going to tell us one way or the other. You're going to tell us, we can pivot here, or we can adapt or adopt some things that are recommendations for you. So that's where the give and take and the two-way partnership takes place. So we've gone through the welcome introductions, the overview, the COFAI overview, the agenda overview, and then we're going to start dipping into the healthcare situation analysis, the community oncology landscape, the infusion dispensing pharmacy strategy, the strategy of community oncology. I only highlight that for the fact that if we were doing a deep dive, that would take up the whole night, one of these subjects. And the elements, in some cases, the sub-elements would take up the entire night. So it is that, if you think about it, going to the movies, I'm not sure who goes to the movies anymore, but you have those trailers and those previews, and then you have the movie itself. I usually look at those trailers and say, okay, what do I want to see next? And what don't I want to see next? Think of it the same way. We're going to give you the trailers tonight. Tell us what you want to see next. So that's really, our call to action throughout tonight for everybody that's participating. I'll ask for comments from the panel, the co-chairs. If not, we're going to jump right in.